Hi, this is Dr. Levi, the fitness doctor. Let's talk about the 5 risk factors for heart disease or cardiovascular disease. The first is being overweight or obese. The second, diabetes. The third, high cholesterol. The fourth, hypertension. And the fifth, smoking. These are the 5 major risk factors for heart disease in America and actually worldwide. Now, why is this important? This is important because heart disease is the #1 killer of women and men in America. So I want to give you some tips to avoid these risk factors, or if you have them, to decrease the risks. Number 1, if you're overweight or obese, it's important that you start exercising. You don't have to do a lot, but guess what? You have to do something. So start off with a walking program or even a swimming program or doing an exercise class that you like. The key with exercise is do things that you like. If you're going to join a gym that's close by. If the gym is 15 minutes to 40 minutes away, it may decrease your chance for going all the time. So it's important to also consider having a person that you exercise with, an exercise buddy, because there's more accountability. And if they don't want to go, maybe you want to go and you can get them. So the key is to have someone there to motivate you when you don't feel like exercising. But exercise is non-negotiable. We have to do it. The second risk factor, of course, diabetes. The key there again is exercise. Exercise will help prevent diabetes along with proper eating habits. The goal here is a diet of balance and moderation, decreasing the amount of sugar in your diet, the amount of salt in your diet, and the number and amount of processed foods in your diet. We have to do it. The next, high blood pressure. Again, exercise is the key here to decreasing high blood pressure and eating properly and minimizing the amount of sodium and salt in your diet. Read the labels. If there's more than a teaspoon of salt per day that you're taking in, guess what? It's too much. It really is. The fourth, of course, is high cholesterol. Again, high cholesterol, or in medicine we call it hypercholesterolemia or hypertriglyceridemia. All of these are bad things, basically. So if you have high cholesterol, and here in America, of course, high cholesterol is defined as 240 milligrams per deciliter of cholesterol. Most Americans actually are always borderline high cholesterol levels, about 200 milligrams per deciliter. What do you do for that? Again, watch your diet, eat properly, and exercise. As I've said so often with all the other videos we shot, you are what you eat. Eat a balanced, moderate diet. Your body will love and appreciate you. Now, when it comes to smoking, I don't have any other way to say it except this. Don't do it. If you're smoking, get help. Join a smoking cessation group. Talk to your doctor about medication possibly. Talk to your doctor about chewing the gum. There's gum that can help with that. Or medication. However, one thing that's been very effective is lifestyle changes. And that is group therapy along with medication, along with the patch maybe, but do something that's very proactive. Cigarettes are expensive, and cigarettes do not give you health. They take it away from you. And think about this. There are more than 440,000 people who die every year from tobacco-related diseases. Think about this. Out of those, about 49,000 die from secondhand smoke. So it's so important to know that this risk factor is to be avoided. Now, I want to tell you something else. When it comes to your body, if you feel something odd in your body, numbness down your arm, tingling in your jaw, back pain, stomach pain, you feel like you have indigestion that feels unusual, if you feel a crushing pain to your chest, often classically people say that they feel as if an elephant is sitting on their chest. If you feel these things, it's important to check in with your doctor, your healthcare provider. Don't wait. And remember this, women present differently sometimes than a man with a heart attack. Sometimes a woman, for example, she may have a feeling of just overall fatigue or a feeling of what we call impending doom. Something doesn't feel good in her body. Or she may have a feeling of numbness in her jaw. Many things are different from the classic signs that a man may have, which is often the crushing chest pain. So I want women out there to know also, if you feel something different in your body, no matter what anyone tells you, go and get yourself looked at. We're here to be of service to you. As a physician and as an orthopedic surgeon, when I have people in my office who have these issues, I immediately get them help. And I want you to listen to your body and get help immediately. if you have any of the symptoms that I've just discussed. Well, this is your doctor, the fitness doctor. This is Dr. Levi.